All right. Well, good afternoon, everybody. Thanks for joining us here for a press conference and update from the city on COVID-19 and our organized response to that as a community. On some calls this week, we heard the federal officials use the sentence, pandemic responses are federally supported, they're state managed, and they're locally executed. And what we want to talk about is the local execution that we're working on here in not only the city of Sioux Falls, but in all of southeast South Dakota here. You know, it's critical that we slow and spread out or flatten the curve of COVID-19. That right now is our #1 priority, is how do we slow the growth and flatten the curve. And Jill Franken, the City Department of Health Director, is going to talk about that in a minute. So it's critical to also understand that every single person in this community has a responsibility right now in helping with that, in helping slow that spread. And so collectively, we can make a difference in this. We've talked to some colleagues in cities that are dealing with this much more extensively than we are, and they're hanging on, but barely. And we're in a unique position right now where we can be proactive on the slowing of the spread, so we're taking some measures to hopefully do that. You know, I'm not going to spend a lot of time talking about the stuff you've heard ad nauseum about practicing good hygiene, because we all know that by now. That's critical. We need to continue to press that message. But because of what we've seen, not only in Sioux Falls, but across the state and across the country and some of the steps that are being taken, we are going to recommend some things to our local health board, who will then make recommendations to our city council, who will hopefully adopt those at a special meeting tonight. And I'll talk about that, why that process is what it is. But today I'm declaring a state of emergency in the city of Sioux Falls. And the state of emergency is declared when the administration needs certain contractual flexibility to do some things that will allow us to expedite responses to an emergency. And so because of that, our Department of Health, or excuse me, our City Health Board is going to be meeting at 6 o'clock, and we're going to be making these recommendations to them. We are going to propose that all gatherings in city-owned facilities are limited for the next 14 days to less than 250 people. So when we look at the schedules and some of the bookings that have occurred and some of the events that we have on the docket, it's going to affect some events in our city for sure. That's places like the Denny Sanford Premier Center or Washington Pavilion, the Orpheum Theater. So gathering in these venues are going to be limited to 250 people for at least the next 14 days, but we'll continue to reassess, and that could be longer as well. The Midco Aquatic Center is going to be closed until March 27 as of right now, and this will all be effective at midnight tonight, so starting tomorrow. Our Parks and Recreation Department and Siouxland Libraries have canceled all their events and programming for the next 14 days, and our community centers will also be closed except for after-school activities until 6 p.m. Monday through Friday. The Washington Pavilion is going to close the Kirby Science Center and the Visual Arts Museum until March 27 as well. Leonardo's Cafe, the box office, and those smaller group gatherings, preschool activities especially, that's especially important at the Washington Pavilion, will continue as scheduled. So the city of Sioux Falls is not taking this lightly. We want to make sure that while we're in this unique position to flatten the curve and stop the spread, we're going to do all we can to do that. And so what will happen tonight is at 6 p.m. our Board of Health will meet, and we will share these recommendations with them. They will then make the ultimate recommendation to our City Council, who we've called an emergency meeting on for tonight at 7 o'clock, and the City Council will have the ability to draft that into ordinance, those recommendations. So we can do that under ordinance based on my ability to declare a disaster, declare an emergency. We can call a special meeting without noticing, so we're using that privilege to enact this process. So you may want to ask, why doesn't the mayor just do this? We got to follow the rules of government to get this done, and that's what we're doing. So those are some of the steps we're taking right now. I will say that this is an extremely fluid situation. I mean, even 36 hours ago, I didn't think we'd be standing up here doing this, but even as the news cycle has evolved over the last 24 hours, people are taking this seriously, and I think that's really good. A lot of the events that we're looking at postponing and canceling, let's just be honest, they're not life or death events. We're talking about basketball games. We're talking about hunting expos. We're talking about things that aren't going to change anyone's life dramatically if we exercise an abundance of caution. And so we are proceeding with the exercising abundance of caution. We're not in panic mode, but we're cautious. And that's what I think people want to know is we're being cautious right now, but we're not in panic mode. And so your city's in a good spot. We're working closely with, obviously, with the State Department of Health on this response, as well as the feds at the national level. So with that, I'm going to turn it over to Jill Franken. Jill's the city's health director, and she's going to share some additional updates on our COVID-19 response.
So the Health Department, in partnership with the State Department of Health and our healthcare partners, has been preparing to respond to COVID-19 since January. And as it's been announced by the State Department of Health, we know we have cases of disease in our community, 3 cases total as of today in Minnehaha County. As a public health director, today I made the recommendation of the mayor to limit large gatherings in order to limit the spread of disease in the community. We do not want the red growth curve to occur. We do not want that to occur. We want to be able to take and spread out the number of cases that we will have and have them be at a much lower level of curve and flatten that curve so that we can give more space for our hospitals, our emergency responders, and others to be able to manage the people that are going to be diagnosed with coronavirus. And so it's going to be really important for us to do these measures. In addition, as we continue to flatten that curve, we can hopefully continue to mitigate the spread and continue to reduce the risk to those vulnerable populations, those high-risk populations in our community. So that's really what we're attempting to do today with this emergency declaration. You all know that each of us, this is a community effort. This is a community problem, and we as a community can resolve to make a difference and make sure that we are having an impact against this virus. So we all have to practice extremely good respiratory hygiene. I know the mayor said that you know that, but I wouldn't be standing up here doing my job if I didn't remind everyone. Make sure you're doing your good respiratory hygiene. You're washing your hands a lot. You're using hand sanitizer if you don't have access to a sink. You're taking those precautions to stay home if you're ill, and if needed, contact your healthcare provider, call your healthcare provider and seek advice. And make sure that if you're in those high-risk populations, you have extenuating health circumstances, you're elderly, please be staying home from the public and staying away from the public as much as possible. Again, like I said, now is the time for us to really continue to step up our actions as a community. And one of the things that we are going to do additionally as the City of Sioux Falls is we are also building out our Emergency Operations Center. We've had a planning group that's been meeting for some time here, and now we're going to actually, as of tomorrow morning, open up our Emergency Operations Center, and it'll be a multi-agency team. We'll be partnering with our health systems to make sure that we can continue to work together to manage through this time period and make sure that we're making really good decisions for the community. So, you know, I don't know if lucky is the right word to use, but we're somewhat fortunate because we've seen what's been happening in other states in the country, and we've been actually, you know, seeing what's happened across the globe. And so we have there's lessons learned, there's best practices already starting to emerge. Just recently we got some new guidance around mitigation strategies for communities, which has helped inform us today in making the decisions that we are. And so we are going to be able to make a difference. That's what we do in Sioux Falls. That's who we are. We can do this, and I have no doubt we can make a positive impact for our community. Thank you.
I just want one last point of clarification before we open up to questions. You know, a limit on events and saying we're trying to put a cap on events of 250 people, those are at city-owned facilities. I can't dictate if a church wants to have church or if other private gatherings want to occur. What we can say is that's the role we're taking, and we'd encourage our community partners to follow suit because we think it's a best practice. It's a CDC recommended best practice. I would encourage those who have events coming up like that aren't in city-owned facilities just to think twice about them, as we have. There's some tough decisions we've had to make because of this. There's some disappointed people because of this, but it's the right move based on what Jill just mentioned in terms of a very proactive plan of response. So we have our partners, Dr. Wilde and Dr. Erickson from Sanford and Avera with us as well, so we'll open up for questions that you have for any of us.
What do you need to see in the next 14 days to lift these restrictions?
You know, I think one of the things we need to see is a slowing of the cases that we've seen in the state. So if we feel that we're starting to level off for some reason, yeah, we can maybe take a look at it. But we're going to be very cautious on lifting those restrictions. Any more than that, Joe, we also have a lot of events that, large events that are booked out further in advance, and they're really watching us. So we don't want to be overly in panic mode and hamper some of the events that we have scheduled in our community into the future. So we're starting with 14 days and we'll assess from there. But we're going to rely heavily on our partners from the healthcare organizations and the State Department of Health to tell us what the trending is and what they feel the community risk is.
When you made this decision, did you know that they were going to, I mean, no one just had her press conference, said there were no new cases in the last 24 hours. Did you guys make this decision before that news was known?
We did, yeah, we did.
Where is your emergency operations center going to be located? Can you tell us about that? What's going to take place there?
So yeah, I'll invite Jill up here as well to talk about this if you want, but our Emergency Operations Center typically is at our Law Enforcement Center. That's where it will be again for this. That's an ideal location because it allows us to catch the media at our public safety briefings as well for updates. How that typically looks is there's city, county, state agencies in there. We're going to have our healthcare partners that will have staff there as well so that we're all communicating. We have a public information group. And one of our goals as a city is just to ensure that we, one, keep the community safe. That's goal number one. But second, that we continue to provide the services we need to provide to our residents while dealing with what is now labeled a pandemic in the U.S. And so, Jill, I don't know if you have anything else you want to touch on the EOC? Okay, so that's how we'll stand that up.
And procedurally with tonight's emergency meeting, you said it was going to be a city ordinance. Does that require 2 readings then, or?
I'm going to turn to my city attorney on that. Come on up here, man. Can't hide over there.
Good afternoon, everyone. Stacy Koistra, City Attorney. Good question, Joe. It does not require a second reading. Like the mayor mentioned, he has emergency declaration powers, but those powers are limited, and they're really primarily 3. One of which is the ability to convene the emergency council meeting, and the second of which is that emergency ordinances can go into effect after 1 reading and go into effect immediately, as opposed to the 20-day waiting period. The third emergency would be suspension of notice requirements for contracts, so that in the event there are purchases that need to be made or remediation measures via contract, that can happen immediately as well.
Thanks. Any other questions for myself, Jill, or any of the physicians we have here? Yeah.
Have emergency ordinances, maybe not to this extent, they've been used in the past, or is this unprecedented?
No, they have been used in the past. We use them during the tornadoes, for instance. The difference with this is the way the emergency declaration is written, it's typically meant for after an event has occurred. Tornado came, we need to declare an emergency. This is a more proactive emergency declaration, thus the couple hoops we have to jump through with the council to do it this way. So it's not unprecedented. Stacy's giving me the stink eye on that, so you can come.
No, that's a true statement. I would just add to that, because it's a good question, that the reason that this one is slightly different, because what the emergency declaration ordinance does is it gives the mayor broad discretion, and it's in the opinion of the mayor when an emergency ordinance or an emergency declaration should occur. One of the things that's different about this one is what the mayor mentioned earlier about the Board of Health convening at 6 o'clock this evening. So the hoops that he mentioned, the process is actually that the health board reviews this. They they'd make those recommendations to the City Council, and the City Council will undertake those tonight at 7.
But we've never closed facilities like this in the history of Sioux Falls.
Now, great. Yeah, he said, have we ever closed facilities like this in the history of Sioux Falls? I'm only 42. I've lived here since I was 2000, and I don't believe so. Certainly not in my 2 years as mayor. So it is somewhat unprecedented, but I think that shows the gravity that we're taking with the issue and the seriousness at which we're taking the potential spread.
What does this mean for state basketball at the TW next?
I talked to Dan Swartos with State High School Basketball or State High School Athletic Association. He's very aware of this discussion. It's not a surprise to him, and they're making some decisions right now at the State High School Athletic Association what they're going to do with their activities going forward. So I think there's maybe some differing opinions that they're working out on what they think the next best steps are, but I expect an announcement from them real soon on that.
Are there numbers to go with that graph for Sioux Falls? Like, what's the dotted line mean? What is the capacity? How many cases can we handle at once?
There's not numbers. It's meant more just to be an example of an illustration. Sioux Falls is really right here. So we have this critical spot right now where we either work on the flattening or work without. So this is not to scale based on our cases in any way, shape, or form. Just meant to illustrate the concept and why cities that do this and countries, for that matter, have more success. Take Italy versus South Korea as an example, with squashing the spread of the virus.
Do we know, like, how many beds do we have in town? Like, do you guys know the data? How many cases do we handle at once?
Yeah, working with, so the question was, do we know the bed capacity and what do we anticipate going forward? I believe was roughly what you had asked. And both myself, working at Sanford, Dr. Erickson, my counterpart at Avera, we've been in close communication several times a day, looking at bed capacity, what sort of movements we need to and steps we need to take in order to maintain bed capacity based on what we're seeing. And what we're seeing here is we're trying to get in front of what we've seen in communities both in the United States as well as China, Italy, et cetera, and the trend of this illness. And that's the importance of the flattening of the curve, if you will. No health system can anticipate or can handle a large surge at a fast period of time, but if we can slow it down by limiting public gathering, social distancing, et cetera, that gives us a good opportunity to provide the proper care for those in need.
I agree with that, Dr. Wilde, and I'd also applaud the mayor and his team for the leadership they're providing. This is very important, and if you look at Italy and what's going on there, they are really, really challenged. They are just overwhelmed. I talked to a group of physicians from around the country and this morning in Seattle in the epicenter, and they are really struggling. It's taken off on them, and their advice to us was you need to do mitigation, which is exactly what the mayor's done in his leadership, and that's why I think it's so important. We are looking at, together, limiting some of the visitors into the facilities, certainly limiting access within the long-term care, and really to take care of our staffs and the patients. And one of the important messages is please call. Do not just walk in. Please call. That's what's important. That helps protect the patient, protect the other patients in there, and also staff and their families. So very important to call, stay home if you're sick, and really monitor a very, very fluid situation. So again, I certainly thank the mayor for his leadership and the work that they're doing.
Who should we call again?
Call your physician. So if you have a illness and you're concerned, call your physician. There's a hotline available. You can call that. But please don't walk into the clinic. Don't walk into an urgent care. Don't walk into the emergency department. Don't walk into the hospital. If you have respiratory symptoms and you had this, you walk in, you can spread this to staff, other patients who then could become sick and possibly die from that, and the other staff. So very important to call ahead so they could be prepared and then direct you where to get your care at and which time.
We don't have any
we're not willing to share, but we've been in touch and we're very well aware of our bed capacity.
Mayor TenHaken, I guess two questions. One, impact on the transit system, people are sitting by each other on the buses. Is there any special provisions for that? Then I'll have a follow-up.
You know, transit's going to be no different than kids at school or people at the grocery store, or we're asking people to be smart. I mean, I'm opening every door like this today, and I'm sanitizing often, and transit's no exception. I think our SAM team, I haven't seen the update, but I have an email in my inbox from them on some enhanced cleaning protocols that they're taking right now. So we're ramping up our kind of disinfectant policies, if you will. So we just ask people to be cautious, be very cautious, be aware. That's why we're talking about this a lot, is people have to be aware of the impact that this has, and ask them to be smart.
And if I may, Your Honor, many of us in this room attended the superintendent's news conference, and he was pessimistic that they have to close the school district down. He doesn't want to, but he thinks he may be heading that direction. What's the city's role in that, and what can the city do if that happens to help people that have kids in daycare, latchkey kids, so forth?
Yeah, if that would happen, that would be a huge concern to the city. And we talked a little bit earlier today about you can kind of factor about a 20% hit to your workforce when something like that happens. And so if that happens for an extended period of time, we have some significant challenges from a workforce issue in the city, as well as what to do with those kids. So we haven't had that conversation yet with the school district. I'm sure we will. We obviously have community centers and other things where we can get creative with some school capacity and some daycare capacity if we had to. This is like a lot of events, though, that happened in Sioux Falls. I think this is the fourth quote-unquote emergency I've had in the last 2 years as mayor. And I believe the community will step up to help if they have to in a situation like that. And so tomorrow we're going to be in touch with the school district on kind of what they're seeing and hearing what their plans are. Jill, do you have a comment on that?
I think the only comment I've made is we have worked closely with the school district on disaster preparedness efforts. We actually did a tabletop around the time of H1N1 and talked about what it would look like if we had to close schools during that time period around 2009, 2010. So we're well aware that there's a lot of considerations that have to be thought through if you're looking at closing schools. And so I know Dr. Maher and his team are taking that very seriously, while at the same time working closely with us, the Department of Education at the state level and the State Department of Health.
All right, any other questions? Well, we talked about that, and we talked about gatherings of 250 people. To me, a gathering is, I mean, we're knocking on 70 people in this room, maybe 50 people. At City Center, Citibank, Wells Fargo, a lot of them are spread out. They're not on top of each other. There's 6-foot distances between a lot of folks there. So I don't think so, at least right now. That's not a topic of discussion. But depending on what happens with a chart like this, those are conversations you would certainly look at having.
We also know that there are many businesses, and we would be within that same realm when we look at our continuity of operations, where we would look at ways that we can have people working from home and still be highly productive. And so we know there's many businesses that are looking at those same measures to reduce if there's a lot of people that work in the same area, but half of them could work at home, and you could have that 6-foot distance between each other and reduce that ability for them to be commingling together. Those are the kinds of things that businesses should be considering right now.
So is this emergency operations center just going to be open indefinitely, or how long will it be?
Right now, the plan will be open indefinitely until we feel comfortable closing it. I think in the example of our tornadoes, Regan, how long was our EOC open after our tornadoes? Maybe
14 days.
14 days. We felt comfortable that we were on top of everything then, and we shut it down. So depending on how long this pandemic is an issue in the city, we'll keep it open as long as necessary.
And where is that at again?
It's in our law enforcement center where the police briefings are. We open up that and on the other side of that wall. So shouldn't affect that, the daily police briefing at all. Okay, well, thank you for coming today. We appreciate it, and we'll likely have more briefings like this going forward as this fluid issue continues to develop. So thank you.